able to capture the dialogue as the questions go back and forth. The other piece too, we'd ask that you do put questions into the chat as we move through the presentation and as I go through the slides. If you do have questions, we'd like to dedicate at least half the presentation to the time to go through questions and answers. If you could please put your full name into the chat as well as your contact information, so that we can get back with you. And we would like to work through a number of the questions as they're presented in the meeting today during our Q&A time. I have a number of staff that are on to assist in answering some of these questions. So for that, I will kick off our formal presentation. Thank you again for joining us today. The vision behind hosting these virtual Medicaid update meetings is to give our agency the opportunity to connect and collaborate with those closely partnered with both Medicaid and CHIP. This is an opportunity to voice your concerns, current experiences, and give us feedback so that we can better serve Utah. As a reminder, we'd appreciate you if you mute your microphone when you are not speaking. If you do have a question, you can select a raise your hand button at the end of the presentation, or if you would like, leave your question in the chat. We will have an FAQ portion of the meeting in just a bit. Closed captions are available for those who would like them. If you would like to turn on closed captioning, please click the options below in the top right corner of your screen and select turn on captions to enable closed captions. To start, we're going to use the first portion of this meeting to go through some Medicaid slide updates that I'd like to go through with you. At the end, we will have a Q&A time for us to go through questions. So to begin, I'd like to just give an update in the areas we're going to cover today, and those will include an outline of, first of all, to address our PRISM updates. And this is our new claims processing system, which is known as PRISM, or the Provider Reimbursement Information System for Medicaid. I'd like to go through a few brief Medicaid unwinding updates, cover statewide provider training, and then go through some policy updates that we have for you as well. I'd like to start first with our PRISM updates. So first, as a background, in April of 2023, Medicaid replaced its 40-year-old claims processing system with a new system called PRISM. Now, Utah Medicaid supports more than 500,000 lives through our Medicaid benefits. So more than 500,000 Utahns do receive their health coverage through Medicaid, but our system alone to support the healthcare services does process approximately 6 million provider claims plus managed care encounters. This accounts for almost $5 billion in business annually to more than 65,000 Medicaid providers and managed care organizations. So when we look post go live after our PRISM system implemented, and many of you were well aware that we had a 3-week freeze prior to our go live date in April. And so what you're going to see here is we look at our PRISM system processing from April, May, and June. We see that in April, there was a nice jump up in our processed claims. We had more than 2 million claims with $585 million in payments going out through our PRISM system. In May and June, you see subsequent payments as well as claims processing go through, but wanted to account that the higher volume in April was due to those 3 weeks of our system being frozen as we transition from our MMIS system into our PRISM system. So our system immediately after go live was immediately processing claims and making payments in that system. The system also has generated lots of calls, and the reason we're of course meeting with you today is to walk through some questions that you have, and we certainly recognize that the providers, you as the providers, have certainly been impacted by our system change. We have a few metrics we'd like to present to you, and one of those that we wanted to present was our call center statistics since our go live date. Our call center does receive, and this is on our Medicaid provider side, receives about 10,000 provider calls per month. Since our go live, We've had about 40% abandonment rate where providers are on hold and they're waiting to speak with a Medicaid staff member. And there's about 40% of providers who do abandon those calls. Our average wait time is 28 minutes. So here you see that after our go live, certainly we had an increase in call volume come to our center with a longer wait time than what we had prior to our go live. And this certainly reflects the changes that have taken place and how they've impacted our providers since our go live date. Similarly, for providers who are submitting prior authorizations electronically, one of the benefits now in our PRISM system is that it's paperless. And as a result, providers can submit prior authorizations directly into our PRISM system. We have again seen an increase in the prior authorizations that have been submitted to our staff. Our staff, for our prior authorization staff, processes about 3,300 medical PAs per month. There has a bit of a backlog in our prior authorization review times since we went live with our system. And that's due to a couple of reasons. Number one is that, again, because we went from a faxed process prior to our system go live, moving into a paperless system where providers had to learn to get into the system and submit claims. Some providers have continued submitting paper claims and faxing those to us. There was a transition period where we did allow providers to do this and we provided further education. But after August 1st, we are no longer accepting paper claim submissions. But one of the challenges that this did present to the team is that they then had to work two processes. They had to work our new process, which was the electronic claim submission, and then feed in our old process, which was this faxed paper process in for providers who hadn't transitioned over. And this certainly contributed to extra time in reviewing prior authorizations. Additionally, after our system went live, it was a rigorously tested system. And prior to go live, we identified many issues and resolved them. But after our go live, we do see some system problems that we need to correct. So there were a couple defects that we're working through. So there are some programming pieces that the team has to move around. At current, our prior authorization review time sits at about 24 days average for prior authorizations. We do see that getting better and getting more efficient as we no longer are receiving paper claims. Since August 1st, we are already seeing some improvements in the backlog. Additionally, our staff are working overtime hours to catch up with this. We have other staff assisting. So this is helping with that. Again, we want to direct providers, both with our call center statistics going up and the calls that are hitting our call center, knowing that you do have questions about your claims processing or around your provider enrollment status, as well as prior authorization. We will be giving you hyperlinks in the chat here, as well as in a later slide, that direct you to our online training resources. We have developed numerous tools and resources that are supposed to be quick links, and whether it's a taped training or just a paper document that does walk you through the training resources that we would like to direct you to help you understand our new system and how to do work within the new system. Moving on to the next slide, well, some of the things that we'd like to share around provider payments and some challenges we've seen that have directly affected you as providers. One of the first things we're going to look at on the left side of the column are the challenges that providers have experienced that are more related to what the provider needs to do differently. On the right-hand side are the things that we are working on specifically with regard to some of the areas that we have in our system. So I'd like to first start around provider enrollment and billing. So the first piece of our new system is it is a more robust, up-to-date system, and as a result has a very different framework around provider enrollment and claims submission and claims processing. The one piece that we've identified early on is that many of our Medicaid providers were not enrolled properly to meet the requirements of our new system. As many of you know, we did robust training. We provided lots of reminders and materials to support this transition, but some providers may not have gotten all those pieces in place. As a result, we had many providers as current providers or new providers submitting provider enrollment modifications or new provider enrollment applications to our provider enrollment team. Early on, we saw a huge jump in the number of provider enrollment applications sent into our team. But our team is now caught up, and they've been caught up since June. We've been able to review provider enrollment applications and keep them up to date so that they are reviewed within 7 days or less. So we would encourage you, early on, there was a backlog as we saw providers had challenges getting into the system. But if you're a provider who's having challenges getting in and reviewing the system, please send any changes or updates to our team so that we can get those processed and you can get into the system. Again, one of the benefits of this system, as an enrolled Medicaid provider, you can get directly into the Medicaid system and look up your claim status or look up your prior authorization status, and it will give you feedback and notes to see where it is in the review status, whether it's been paid, if it's been denied, and why it's been denied. So we would encourage you to if you haven't done those things, to actually get in and look at claims and understand that. And it maybe can help with some of the delays that we're seeing on our call center side as well. Another challenge that we've seen with our new system is that providers were very, of course, used to billing our old way in our old system. We've been, with our new PRISM system, be able to update to meet all of our current HIPAA standards, to meet the X12 standards around documentation and claims submission. It certainly requires many different changes to the way some providers have submitted claims in the past. And as a result of incomplete or inaccurate claim submission, a lot of providers are seeing rejections or denials on their claims. We have been working very closely with providers, doing training or working through any questions that providers have around denied claims by providing training. But again, I refer you to these online resources that can really help with claim submission and accurate claims billing. What we have seen in our denial rates from the time we launched in April until now, 4 months later, is that we've been able to see denial rates drop from 46% to 36%. And this is what we're looking for, so that we know that providers are learning how to submit claims and being able to do that accurately. We are here to support you and answer your questions. So please keep those questions coming in. But we also do like to see that trend. Now, moving to the other side of the coin with this is the fact that our system, when it launched, does have some defects or change requests or enhancements that we are programming into the system. Much of what we're seeing with our system, while it was designed over a number of years, and we're saying this was a 10-year project, is that while we did design the system, we know that there are places where there are system defects. What we have found is that there is a process for a prioritized defect resolution. There have been many defects now that have been submitted. More than half of those have been resolved, or they are assigned to a release status. So we are doing change requests with system updates and releases that are done at a monthly cadence, sometimes more often when we have emergency releases now in these early months of our go live status. We have captured these for you on our PRISM website, so you can see with defects what is in a release. We have provider notes under the PRISM release note section that will describe what is included in those updates, and we are actively working to prioritize and address problems as they work through our system. In addition to this, because we know that there are workarounds for some of these defects that we've identified as denial reasons, we have hired additional staff that are working some of these denied claims that are hitting a defect so that we can get these claims to process and get the monies paid to providers. We have also pushed out some interim payments to providers to facilitate where there's not a delay in some claims processing or defects holding up payment. We are working individually with some providers to facilitate interim payments so that providers can get paid. We appreciate your partnership with us, providers. We recognize there have been some provider payment challenges on both sides, and we want to work partner with you on that work to get some money flowing and make sure that your training is occurring, that we can support you in that training, get you to submit your claims, get those processed, and help support and facilitate care to Medicaid members. The last thing around PRISM updates, and I recognize that is why many of you are here today, is to ask questions about this, is to direct you to our PRISM provider resources on this tab. So medicaid.utah.gov/PRISM does contain those updates. It has provider trainings that we gave all up until our go live and post go live. We have FAQs and guides, contact information, and lookup tools and resources as well. So moving on to my future updates, we want to get into our Q&A section. So I'm going to move quickly through our unwinding updates and some of our policy updates so that we can focus on some of the PRISM questions. Now, another big activity as I move from our PRISM system going live in April to another very large activity our team has been engaged in this year is the unwinding of the continuous eligibility requirement that has been in place through the public health emergency. So as a quick background, many of you are aware that our Medicaid federal requirements were to keep a person who became eligible for Medicaid continuously enrolled in Medicaid throughout the duration of the public health emergency. In March 2023, our enrollment actually reached the highest point it's ever been in our Medicaid and CHIP programs. In our state, we enrolled more than 531,000 individuals in our program. And this is also the date we began reviewing each person's eligibility as a kickoff of our unwinding activities. Now, unwinding activities means that we have 12 months to review every person's eligibility and determine whether or not the individuals belong on Medicaid or should be transitioned to another program like CHIP or other coverage options such as the federal health insurance marketplace. This is another enormous task that was kicked off earlier this year. A couple important definitions to appreciate when we talk about our unwinding activities is that our flow of activity as we review members' eligibility is that first and foremost, as we have targeting of our population, I'll first start and say that of our 531,000 individuals that we are reviewing their eligibility, about half of those individuals continue to have an eligibility review during the time of the public health emergency. So about half of our population, for other reasons, because of other programs that they were receiving, also received a Medicaid or CHIP review at that time. So we are aware of their 12-month review timeframe. The other half were where we didn't have an eligibility review completed. We were able to look at this group and prioritize over 12 months which individuals we would like to review first. And in the context of that, we started with our higher risk population, or those, not higher risk, those individuals that were less likely to remain enrolled in Medicaid first. And those were individuals who we had information that they may be over income, perhaps they had employee-sponsored insurance, or perhaps they had not utilized any services on the Medicaid program over the last many months. As a result, we actually reviewed these individuals and prioritized those first, and then put the individuals that were most likely to remain on our Medicaid program later in the review process. Now, as we undertake the process of a review, there is the first step of the process as we're looking at an individual's eligibility is a process of ex parte, where the eligibility worker at the Department of Workforce Service looks at an individual's eligibility, and they are able to review a renewal and make a consideration about a renewal of eligibility without the individual completing a form or providing documentation. This renewal is based on information already available to the eligibility agency, and as a result, we can make a determination through ex parte if that person is to remain on the Medicaid program. We are not allowed to close any cases through ex parte, but if an individual case cannot be reviewed through ex parte, we then send out a pre-populated form for the individual to complete. When an individual gets that form and does not respond to that form, the case may close by a procedural closure. And the procedural closure, and this term that we use, called procedural closures, refers to the termination or end of an individual's Medicaid or CHIP coverage due to administrative reasons or procedural issues, such as missing paperwork. They didn't return their form, for example. So what we'd like to talk about and share with you quickly is our status of eligibility reviews through June 2023. So this incorporates our review started in March, and this goes through the end of June 2023. In this time, we know that about 179,000 individuals were reviewed for eligibility in the Medicaid and CHIP programs. Of this, we had 81,000 individuals renew and 98,000 individuals close. Of those individuals that closed, and again, this is a snapshot in time, approximately 30% of closed cases were able to be reopened through by having them submit a form. So there is this opportunity after a person's Medicaid or CHIP eligibility closes that they have 90 days to submit their application and become retro enrolled in the program. And about 30% of individuals have had their eligibility opened through that process. If we look at the stacked bar chart on the right, we see the breakdown then that about 23% of cases were renewed through ex parte. Another about similar amount were renewed by submitting their form. Some were closed, that yellow bar that says closed through determination, that was through review. And we see that large piece that shows that many cases were closed for procedural reasons. Now, the last step I'd like to cover on this is that there are constant improvements being put in place as we review this process and go through our unwinding activities. There are always opportunities for us to look at how we're doing our work, evaluate the data, and consider the next steps and how we may improve our steps of eligibility review and our unwinding activities. And a couple things I'd like to call out are that, first of all, is the use of automation. Our ex parte process today is very manual. It requires that the caseworker does touch that at each eligibility review that's being done. What we want to do is automate it so that the system itself can take pieces of data and make a determination on many of those cases and auto renew people based on the eligibility information that is there without the individual ever having to touch it. We believe that this will increase our ex parte volumes and reduce our rate of procedural closures. The next step is that we've done work on our eligibility notices. While members do receive multiple notices in the mail or electronically, we know that there is ongoing work to make that process better and make sure that our language is clear, that our members understand what action they need to take. And certainly this is a step that we would love to get your partnership on in helping people understand this process of unwinding, what it means to complete the form again, and then go through that process of the renewal and know what's needed in order to get their Medicaid eligibility considered and reevaluated and reinstated. So that is another piece we're going to continue doing, is looking at our notices and how we can improve those. Next is analyzing our data. Certainly we can learn a lot by looking at the procedural termination data and understanding. I mentioned that many of the reviews we were doing early on in our review process were supposed to be for individuals who were less likely to be eligible. These were individuals where we knew their income was over income, or maybe they had other insurances. We want to evaluate that and see if that data reveals anything to us around areas where we can improve our work. And last is stakeholder partnership. We need to hear from you as providers in the field and advocacy organizations, those who are working directly with our members, to really be a very good voice of feedback for us and help us improve our process, but also to be the front line for helping people, Medicaid members. We have numerous resources on our Medicaid unwinding website that we hope that you've been able to take advantage of and put in your offices and share with members when you're working with them, help them understand what unwinding is, that they need to act when they see eligibility review come their way. They need to submit those forms back to us so that they don't have an interruption in coverage. And we would really ask you to partner with us in this work so that we can take advantage of of our whole continuum of care as we're delivering services to Medicaid members and really improve the care and the outcomes that people get so that there is not a break in their eligibility and people understand what's needed for them during this time of unwinding. We have numerous resources available. As I mentioned, we'll put these hyperlinks into the chat so you have it. There is also an eligibility unwinding dashboard that is on our unwinding webpage. We would like you to look at that details many different data bullets around unwinding and activities that, and we're happy to take any questions you have in this area as well. So next, I'd like to transition over for just a minute into some updates around statewide provider training, as well as a few policy changes that are coming in the next few months. So first is statewide provider training. Utah Medicaid will be offering the 2023 statewide provider training in an online live webinar format starting this month, August, and running through September. You see some dates highlighted here on this screen, as well as the next screen. You see these training sessions are broken down by the different topic areas that we have. Providers can sign up to attend multiple trainings. So certainly we kind of set these up so that you were able to look and see what was available, and you can certainly sign up for multiple trainings. When you register, we do have an online form for you to register that we'll put in the chat. Please provide specific questions that you would like to have addressed during the training. This will assist staff in preparing the slides and obtaining answers ahead of time, and certainly helps us be more prepared for questions that you might have. If you are interested, please register for the trainings using a Google form we have posted on our website, and we'll also, if it has not yet been put in the chat, we will put that into the chat now. Some policy updates that we'd like to highlight for you that are coming in January in just a few months. First, I'd like to highlight a new program called our State CHIP program. So during the 2023 General Legislative Session, Senate Bill 217, called Children's Health Coverage Amendments, authorized the department to create a new category of eligibility for the Children's Health Insurance Program, or CHIP. This eligibility category is for children who are not U.S. citizens, but are now may be eligible to receive CHIP benefits if you meet income requirements of 200% of the FPL and meet other eligibility requirements as listed here. Those being under the age of 19, not covered by other health insurance, have a parent with unsubsidized employment, not eligible for another Medicaid or CHIP program, and have been residing in the state for 180 days prior, at least 180 days prior to the date of the application. This program will be run through an open enrollment format that will be available on January 1st, 2024. This is a pilot program. It's a 3-year pilot program that has been given limited funding of $4.5 million. So it will serve about 2,300 or 2,300 so members per year. We don't have all the answers yet, but we are excited for this new population to have access to low-cost, comprehensive coverage. We are in the process of updating our systems, both our eligibility system as well as our PRISM claims processing system, so that they're ready for these program changes. You will see more information available on our CHIP website around October 1st. We will send updates in our monthly MIB newsletter article, and we will also have our CHIP website updated with more resources as well that will help members and individuals who may want to apply for this program. A couple of other things I'd like to just quickly note are some changes that are going to first offer 12 months continuous coverage. The first is to children on January 1st, 2024. Any child who becomes eligible for Medicaid will have 12 months of continuous coverage in that program. We already have 12 months continuous coverage in our CHIP program. This will also be aligned in our Medicaid program as well. Likewise, through our last legislative session, we saw 12 months postpartum come through that as a bill, and are able to implement 12 months postpartum coverage pending final CMS approval. We're working with our Centers for Medicare and Medicaid Services on our final pieces of this, but our hope is that we can also implement 12 months postpartum in January of this year, which gives women who are postpartum, what they now have is 60 days coverage. This would allow them to have 12 months coverage after delivery. Last but not least, for my presentation updates would be the changes in our non-traditional Medicaid benefit. On January 1st, 2024, there will be changes to Utah Medicaid's non-traditional benefits. Now, the non-traditional benefit plan will have the same benefits as our traditional Medicaid benefit. This was directed by the Centers for Medicare and Medicaid Services, or CMS, in order to eliminate disparities between these two plans. This will affect multiple Medicaid programs, including parents on adult expansion Medicaid or parent caretaker relatives, our 12-month transitional Medicaid program, our 4-month transitional Medicaid program, and our family medically needy program, which is our spend down. There are numerous benefit changes that this will cover. One is non-emergency medical transportation will be available now to this group. Previously, it was not. Members can go to My Benefits to see if they are eligible for the UTA transit card. If they are eligible, they can begin using their UTA card after January 1st. It also makes 19 and 20-year-olds who are in these programs today eligible for EPSCT services. So that is a more broad array of services than what they had under the non-traditional benefit. It also expands access to and the scope of services around, or the quantity of services around physical therapy and occupational therapy, speech services and audiology services also become available, and changes to the medical supplies, medical equipment, and long-term care. So details about these changes will be mailed to members and posted on our website as we get closer to the implementation date. So with that, that does end the formal presentation that I have for you, and it is time to dive into some questions. So with that, we're going to turn the time over to you. We want to hear your questions and provide feedback from your interactions with Medicaid. So with that, we'll go in, and I do have a number of my team here with us that is going to come on camera. We have our subject matter experts with us here, and we would love to take your questions. Okay, so some of these we do have some prepared responses for. So as we are going into these, we'll just start first for questions submitted during the call. First, it's from Lindsay. I've noticed the average call time has been over an hour for the last several weeks. Is there any chance for increased hours again? And our response right now is that we did make a change to our customer service unit phone policy, and wait times today have actually been cut in half. We are not giving out claim status information. That is one thing that's important for us to know. We've had a barrage of calls coming in from third-party vendors that have been calling our lines all at once and filling up our phone queues, asking us about claim status. This can be found in our PRISM system. And as I called out earlier, enrolled Medicaid providers can log into the system and look up the status, and we are directing providers to do that. If a provider needs help to find the information, we're happy to help support you through that process. Okay, next question that came in is around prior authorization. In the PA training, there is a mention of bulk PAs through the 278 process. I have been unable to find how to do this. Is there any further information on this? So I'd like first to call out and see, I'm not sure we can answer that question directly on this call. Do I have a team member who can answer this question?
Yeah.
Great. Oh, Tiffany, thank you.
Yeah. Gary, I just took a look at your user and your NPI. You don't have the EDI exchange transaction on your provider file in order to submit those 278 files for the PA.
So do you want to talk, Tiffany, about what they need to do to update that?
Yeah, you would need to do a modification and update your, the section is the mode of claims submission section. And the available transactions you'll need is the 278 prior authorization request response file.
Thank you, Tiffany.
You guys able to hear me or no?
Hi, Gary. We can hear you.
Yes, sorry. Thanks for that info, Tiffany. It would be great if you could maybe lead me to a training on that as well. I'm pretty new to the system, or Prism is pretty new for everyone, but I'm pretty new to the medical billing world, and I do try and go through your trainings, and they are very informative, but I just couldn't find anything on how to get this added. You mentioned, sorry.
Gary, if you'd like, would you mind sharing your contact information, and a member of our team will reach out directly with you. You will have to update your provider enrollment status so that you can do this. And if you're willing to share your contact information with us, we will reach out to you directly to assist you with this.
I'll put it in the chat. And I thought I did have every single enrollment that I could choose from Prism, so I'm not
Okay.
in that yet. But I'll put it in the chat and look forward to chatting to you.
Thank you for sending in your question, Gary. We're happy to help you.
Thank you.
Yep. Thanks, Tiffany.
Also, I'm looking for the link for the companion guide. So there is a 278 companion guide, and I'll include that in the chat as well once I find that. And I see that Shandy has added the training link in the chat as well. But I'll get that link to the companion guide added.
Great, thank you.
Thank you, Paula. So Gail, you have the next question around immunization claims, and I believe, Brian, you may have processed this, but the question was, can we address the needed program changes for immunization claims on this call? Has that been completed, and how will the reprocessing of those claims be managed? So there was a response that claims analysis from the program code release is underway. Once this has been completed, claims will be identified and reprocessed. Is there a team member that would like to take this?
I think Gail, I appreciate your questions, but I think there may be a couple of questions here. The July 2023 Medicaid information bulletin went over some new vaccination counseling codes. And I know those specifically are visits where vaccination was not administered. It's just the member seeks counseling on whether to be vaccinated, and specifically excludes the administration. So those are some new codes. They replaced a single 99401 vaccination counseling. So I think your question somewhat had to do with those new vaccination counseling codes. Those are different than administration of vaccine codes. And I hope that kind of gets to your question, Gail, but please let me know if you have further questions.
Brian?
Yes.
That does not. I'm actually speaking to line items on the claims that are being denied. There doesn't seem to be anything. The common denominator is that there's vaccines on the claim, but there doesn't seem to be a rhyme or reason for denied lines on the claim itself. Sometimes it's the E&M code is denied. Sometimes it's the admit code. Sometimes it's the entire claim. But every single one of our claims that have immunizations on them have been denied inappropriately. And I have been told by a couple of different reps that that was a known issue, that it did require a program fix, and that would be happening sometime in August. So I was just following up to see if that had been.
Okay, Gail. Well, I can see the team might be looking at the date of that fix. Sorry.
Okay.
Yeah, I think this is probably one we need to
Take
dig
offline.
into a little bit. Yeah, take offline and dig into a little bit more. Just make sure we have the right fixes and are not talking about it too generically.
Gail, is there a way you could put your contact information into the chat so we could look at specific TCNs that you're experiencing and that we could look those up for you?
You bet.
Thank you.
Thank you.
Okay, next question from Lindsay. The documentation portal still does not upload for me. Is there a fixed date with this program? And we have a note that the fix is scheduled for September 13th, 2023 for that piece.
Yep, we have a piece of that that has to go out to a separate vendor for their fix. So that's the reason for the delay on that one. So
Thank you, Jason.
Yep.
Next is from Laura. Denial reasons cannot be seen in Prism. I was told by customer service that we have to wait until the RA generates the following Monday. Will this change so we can see the denial reason in Prism? Will we be able to get the RAs through our clearinghouse like before? Okay, and I don't know who would like to take this response.
I can take it, Jen. I don't know, Laura, if you have any questions since we populated the information on the website for you in the chat, but the information is on your RA and you can download it that following Monday. I think the payment from Friday to Monday, it's a pretty quick turnaround time. Is there any specific reason that the RA, the wait for that doesn't work for you?
Well, I had uploaded some claims. They were immediately denied. And this was on a Tuesday. And when I called in to find out why they had denied, they said that I had to wait till the following Monday in order to see why the claims had been denied. And I was just wondering if there wasn't a way to, I mean, if they're immediately denied, why couldn't we see an immediate reason for the denial?
I'm not sure if Mel or Jason, if you guys have any thoughts on that, but you're talking about the real time?
Yes.
In the real time submission.
Yeah.
We may need to follow up on that one. I am not quite sure about pre-adjudication responses. So if you wouldn't mind leaving your name and number or your email in here, we'll follow up with you on that one. And just put a little note that it's the pre-adjudication question.
Okay. And the other part of that was getting the RAs through the clearinghouse like we used to. I haven't.
You can download them from the website, from your provider access into Prism. You can download those yourself.
Yeah, the format's just completely different. And so I was just wondering if they were going to go back through the clearinghouse or if that is out of the question now.
I think you'd have to work with your clearinghouse to just, for that situation. If you have specific questions, maybe there's something our EDI department can help you with. If you want to reach out to, I'll put the number in the chat and the extension. Have you talked with anyone on our electronic data interchange team?
No.
Okay. Let me put the contact info there and reach out to them if you'd like.
It's Gary here again. I have that same issue. Since Prism went live, we're not getting the 835 messages back into the clearinghouse to the billing company. So we're unable to see what has been paid besides getting manual downloads, which creates a lot of extra work on our side. So I had the same question, why we don't get I think it's the ERA 835 messages being sent back to the clearinghouse into the billing companies. And they actually, sorry, just a bit more context, they actually phoned you guys and mentioned that there was an issue on your side that was being worked through.
No, I don't think there's an issue on our side. I think a lot of what we've been working through has to do with making sure that your trading partner numbers are set up correctly with your enrollment, and so that your transactions, each transaction has a trading partner number assigned to it, and you've got to make sure that all of those numbers line up and everything is working correctly with your clearinghouse. But our EDI department can probably help you. We've had this question come up quite a few times.
Okay, thank you.
I'll put that in the chat right now.
Thank you.
Thanks, Shannon.
Okay, thank you. Okay, Teresa. Okay, so Gail, you had a question as well around immunization, so I don't want to skip over that, but I think that maybe is what we discussed. Making sure here. Okay, sorry, I'm going out of order. Next is Teresa. Here are a few issues that we have been unable to get resolved through calling related to claims. And you have a few different things here, Teresa. We would like to reach out with you directly on this to deal with your 3 different issues, and we will have our staff do that. So Shandy, I can see the questions are detailed here, and we can reach out. But specific to the incarcerated question, we do want you to reach out to Lisa Tuckett. So we have a link we'll send you on that, Teresa, but we'll work with you directly on your questions, if that's okay. Okay, Dr. Woolsey, this may have already come up, but can you explain the difference of the codes for vaccination counseling and the new adult physical exam codes for EPSDT versus regular adults? Can you describe EPSDT is without restriction? What restrictions apply to EPSDT? So the restriction I think that you're wanting is that there is a maximum of 1 visit annually for members over the age of 21. Does that answer your question?
Yeah, for the adult, and Brian got that one. Thank you. Can you just do, what's the difference between GO312 and GO314? Again,
Yep.
so we can explain it to our ouch members. Thanks.
Thank you. Go ahead, Brian. I think you have that one.
Yeah, so GO312 and 314, the only difference is 314 is specific to the COVID-19 vaccination, and 312 would be all other vaccinations. Both would be counseling service. I will also mention there's actually 4 codes. 312 is 5 to 15 minutes. 313 is 16 to 30. And then 314, 315 also have a time difference, but both specific to COVID-19. And all the details are on page 22 of the July 2023 MIB that I'll just post into the chat.
Yeah. Hey, Brian, can you just clarify that there's this qualifier that this code is used for the ESPDT? Is it for all codes or just ESPDT? So just let me make sure.
It's for either.
Okay, thank you.
Yeah.
Yep, thank you. Okay, next question from Trisha. Can you share any letters or communications sent to Medicaid beneficiaries that we can send along with our own newsletters about the unwinding process? And I believe where there's a response in the chat directing you to our medicaid.utah.gov/unwinding/ which does contain all of our member communications. So if you were to scroll down on that medicaid.utah.gov/unwinding website, you'll see we have provider communications as well as all the member communications as well. And so all of that is detailed, available in English and Spanish for the member side. We would love for you to utilize that, be familiar with it, and share it with members where appropriate. Thank you for working with us on that. Teresa Brooks, we are also having an issue getting our hospital claims to go out. We are working with our clearinghouse to resolve this, but they are saying we are not enrolled per Medicaid. When we call and look at our enrollment, we are told everything looks okay. Our claims were getting out at some point in May, but for some reason they stopped. Is there a contact we can get in touch with for help? So Shandy, would you like to take this question around provider enrollment?
Yeah, I think if you could send us your information through email, email it over to, I'll put the email in here. I don't know if you want to try to work with her and Debbie on this issue. You want me just to give her your email address and you can coordinate something with Debbie?
Yep.
Okay. If you'll send it to estall@utah.gov. And specific claim examples would be really helpful. Oh, there's an L on there. Let me fix that. It's ESTAHL@utah.gov.
Okay, thank you.
Mm-hmm.
So the next question is from Rosie regarding the non-traditional to traditional benefit for adults to have access to vision and dental benefits. So I'll ask Brian to answer that question, if you don't mind, Brian, around the specifics with vision, but also the populations that do receive dental today.
Yeah, yeah, happy to. So vision is a covered benefit for non-trad. We were just, going over some of the codes that are available specific for optometry earlier today on a different subject. So the exact codes that are open for non-traditional populations are on our coverage and reimbursement lookup tool, which I'll post that in the chat. One moment. So you could search by code, and for I don't know which provider group you represent, but if it is, for example, an optometrist, you could search by code and see the details for a non-traditional coverage. And then as far as dental, non-traditional do not have a full dental benefit. They do, however, just have the ability to have some emergency dental procedures like tooth extractions. And we are in the process of requesting CMS approval of a full adult benefit for dental. That may take a few months at least, but we are in the process of requesting that. So come January, that non-trad population will move to a traditional benefit plan. That specifically won't give them dental, but the longer process of getting the CMS approval of all adults having dental benefits will give that benefit to all other adults. So that's what we're working through right now.
Thank you, Brian.
Mhm.
Okay, so the next question is from Children in Motion regarding the same problem that was identified by Teresa. And again, we would like to direct Children in Motion, please, to our provider enrollment and specific claim denials to Emily Stahl. So we have an email, estahl@utah.gov, that we have put into the chat. If you'd be able to send specific questions, that would be very helpful. Thank you.
Jen, just one quick thought on that. When I'm reading the questions over again, it might be, Emily, that it's you and Diana. If the provider enrollment is set up correctly, I don't think it's enrollment is that. I think it sounds more like the problem with their trading partner numbers and things again. That
Right. I
seems
think
to
it
be the
might
root.
be how, yeah, sorry, didn't mean to interrupt you. It might be how they have actually, according to Diana, how they've signed up to get their things. That may be something that they're just missing, and we can work with them on that for sure.
Right. I think what might be best too is to contact EDI first for those that are having problems and work through EDI before contacting Emily, because I think this is probably what Emily's going to do anyways, is contact Diana and have her work through it. So I think it sounds like your problem might be pinpointed to the setup of those electronic transactions, not so much your provider enrollment in our system for enrollment purposes.
Right.
Yeah, that's what I was thinking too, Shani. So
Okay.
it may not be the same problem for each of them. So
Right. So I would redirect you to contact EDI first.
Thank you. Thanks, everyone. Okay, next question. And I'm just keeping an eye on time here. Knowing we have 5 minutes left, we'll keep moving through our questions. However, we recognize there are several questions we may not get to, but let me continue moving through them. If not, we will communicate with you via email to answer your question. Next is from Casey. We bill ORPs and our claims are being denied automatically due to not being rendering providers. We've been working with Medicaid rep that said they have to manually push our claims through. Shandy, do you want to provide a quick update on Casey's question and it being specifically an ABA therapy provider?
Yeah, so thank you for the question too. We are very well aware of the issue that is causing the situation to happen. And on the ABA providers, we're working through them as quickly and fervently as we can. If there are some significant outstanding claims that you need to get pushed through, would you please put your email in the chat here or reach you could also reach out to Emily. I know she's working a lot with those ABA providers. We are, I think, a lot closer to a solution than we were before, but it's still going to require some manual intervention on staff's part to get those claims processed through. So it is a little bit more cumbersome than we'd like, but we're aware of the issue and trying to get that taken care of as quick as we can.
Thank you, Shandy. Next question from Gail. If the Utah Medicaid eligibility system shows eligibility that differs from the ACO, which system rules? Also, does the member contact their ACO to get that result? And who would like to take this question?
This is
Greg?
Greg. Yep.
Thanks, Greg. Go ahead.
Yeah, thanks for the question. So a couple things, as noted, right, with the implementation of our new PRISM system, we along with that came our new PRISM data warehouse. And so we've been working through some issues that we had with just getting the information in the data warehouse to become available and for us to get that information in a timely way. Speaking of timing, one of the things we identified was that there may be a change in PRISM, but that change may not be updated immediately on the eligibility lookup tool. So one of the things we are looking at now is increasing the refresh frequency of that information so that PRISM and the ELT sync up better with respect to the timing of the information and making that available. One of the things we've been working with on the ACOs is the eligibility enrollment files that we send to the plans. Those files have had issues. We most recently produced files this last week that we've pushed out to the plans. We think those files have a pretty good representation of the enrollment with the plans. And so at this point, it would make sense for members, if they have questions, to actually reach out to the plan first to see how that information corresponds and any efforts or help that the plans can provide with respect to that. The plans are probably still engaging in just uploading that information into their systems. However, I know that they're doing that as quickly as possible. So multiple things going on here. And then we also have just a follow-up question that we'll probably send out just a written comment on with respect to PRISM and the eligibility lookup tool.
Thank you, Greg. And thank you, Gail.
Jen, could I just interrupt for 1 second?
Yes.
Casey, could I get your NPI and just make sure that I have your claims that we're actually actively querying so that we can get those adjusted for you?
Thank you, Emily. If you want to reach out to Emily directly with your NPI, that would be fine as well. If you'd like to do that, Emily's contact information is in the chat. Thank you, Emily, for that request. I am looking at the time. It is 11:59. I want to recognize there are numerous questions still in the chat that I know the team is actively working on. If you did not provide your contact information, we would like to ensure that we are able to get in touch with you. Likewise, we've also given you our contact information where you can reach us. But we wanted to close today and just assure you that we will get back to you on your questions. We do want to make sure this is an opportunity for you to provide questions to us and us to reach back and help you. And we want to be able to make sure that we can make that connection. But we want to thank you so much today for your attendance and the opportunity to meet with us. I really value your feedback, and so does the team here who is on this call, and your experience working in our system. We appreciate you so much. If your question was not answered during this call, we will send you through in the Google form. There is a form we also want you to fill out if needed. If other questions come up, go ahead and put your question in that form, and we will make sure we get back to you. If there are additional provider questions or concerns, you can always call our Medicaid hotline at 1-800-662-9651 or email medicaidoutreach@utah.gov. If you have PRISM related questions specifically, please email at prism@utah.gov utah.gov. So prism@utah.gov. This inbox is prioritized, is looked through multiple times per day, and we are triaging and working up any questions that are brought through that form. So wanted to thank you again for your time today. We appreciate your attendance on this call, and we look forward to seeing you again. Have a good day.
Thanks, bye.